Hello, my name is Maria Leota. I'm a registered nurse working as a nurse liaison for Paragon. I represent the 4 Nassau County facilities. They are Emerge Rehab and Nursing, Excel at Woodbury Rehab and Nursing, Limbrook Restorative Therapy and Nursing, and Glen Cove Center for Nursing and Rehab. The purpose of this short video is to give you and your family an insight to what to expect if you are hospitalized. In most cases, hospitalizations are unexpected and frequently stressful. A good deal of the stress comes from the unknown. We at Paragon would like to assist you in easing that stress as much as possible. Upon admission to the hospital, the staff will begin to plan for your discharge. This may sound a little odd to you, but that is the ultimate goal. Yes, there will be diagnostic testing, procedures, treatments when necessary, but these are all put into effect to achieve the ultimate goal of a safe and speedy discharge. Healthcare has changed dramatically over the course of our lifetime, most especially now during the COVID-19 pandemic. No longer are patients kept in hospitals for lengthy stays. The patient is stabilized and a decision is made for a safe and appropriate discharge. Sometimes that discharge could be home with assistance from family if needed. Sometimes a home care agency will be called in to assist with nursing, therapies, and nurses' aid services. Please be aware that most insurance companies, including Medicare, will only pay for a limited amount of services for a short period of time. In some cases, that is not enough to maintain the patient's well-being. When that is the case, it'll be suggested that rehab be the best option. This decision will be made by the patient's family, and the doctor that rehab would be the most appropriate and safe discharge plan. Once it is decided that rehab is the plan after hospitalization, the case manager at the hospital will put the wheels in motion. You should be aware that there may not be a lot of time for these decisions to be made. It would be helpful for you and your family if you discuss these options before they become necessary. Perhaps you'll be lucky and never require rehab, but I'm sure you would feel better having knowledge about your choices. When rehab is the decision, let's discuss what to expect. The case manager will give you a list of facilities in your area. She will ask you to select 3 choices. The facilities must be within network of your insurance plan. This is very important to take into consideration. Most people will look for location first. Although demographics could be considered, the more appropriate option should be based on you receiving the best possible care. Although you would want visitors, with the current state of the pandemic, visitation regulations are constantly changing. Therefore, location becomes less important. And please remember, rehab is short-term. Our goal at Paragon Rehab is to help you to achieve the optimal level of functioning. Your length of stay will be dependent on your state of abilities and your physical health when you come to the rehab. Quality of care is the most important consideration. Our 4 Nassau County rehab facilities each offer individualized care and each specialize in a different area. Limbrook Restorative offers cardiac pulmonary program as well as an amputee program. Glen Cove Center and Excel also have a cardiac pulmonary program. Emerge Rehab offers a brain injury program. Paragon facilities are now offering a navigator program. The navigator will make sure that all your services are in place. Also, please be aware that if you return to the hospital from rehab, the navigator will follow up with you there as well. When making your selection, be aware of which facilities offer which specialty dependent on your needs and current diagnosis. All of our facilities have 24-hour RN care. There are LPNs and aides available round the clock. Upon admission, you will be evaluated by our therapy department. A plan of care will be created with your specific needs addressed. Physical therapy, occupational therapy, and speech therapy are all offered in our buildings. You will receive therapy twice a day, up to 7 days a week if you're able to tolerate it. You will be assigned a physician who will oversee your care. We are also affiliated with numerous specialists who are available for you if needed. The case manager at the hospital will put your medical records online for the facilities that you have chosen to review. That is where my role comes into play. I will receive notification that there is a patient looking to come to one of my facilities. I will evaluate your diagnosis and current conditions and abilities and help to make the best selection for you. Along with the admissions office and the nursing staff, the rehab will begin to prepare for your arrival. The hospital will arrange transportation to the rehab facilities either by ambulance or ambulette. Some insurance companies will pay for the transportation, or you will be billed. It is recommended that you arrive to rehab by this means rather than have a family member drive you. You should bring 6 to 8 changes of clothing. Please have your family member label your clothes. You will be up and dressed each day. Please bring casual, comfortable clothes that are machine washable. Also include comfortable footwear like sneakers. You may want to dress in layers because you might get warm when you're exercising in the gym. I want you to be aware that it's also your right and your healthcare proxy's right to review your medications. It would be helpful if a family member brings a list of your home medications for the rehab to review. Although it is not permitted for you to take your own medications, the rehab can order these meds from our pharmacy if your doctor orders them for you. Although physical touring is not permitted at this time, please go to our website for each facility to get more information. Feel free to call our facilities. Our staff will be happy to assist you in any way they can and answer any questions that you may have. We at Paragon understand these are stressful times, and the thought of going into rehab can be overwhelming. Hopefully you'll never need to be hospitalized or go to rehab. If that does happen, please remember we are here to help you. Thank you so much for taking the time to view this video.